about to see a remarkable device designed to make the care of your bedridden patient easier, and best of all, safer. It's called the Barton Positioning and Transfer System.
Current transfer systems are labor-intensive, time-consuming, and often dangerous for both patient and staff. The new Barton Positioning and Transfer System is designed to let a single caregiver easily and safely move a patient from bed to stretcher and back again. The results of a recent University of Utah study offer dramatic proof. The Barton was the only transfer method that allowed caregivers to move their patient within OSHA standards for back safety. Best of all, the Barton requires only a single caregiver. The Barton has gotten enthusiastic response from hospitals and nursing homes around the nation.
Since the chair's been here, though, it's been here for probably maybe a month and a half. There has been no injuries, none whatsoever. So the chair has been like a lifesaver to a lot of people.
As an RN and working in a nursing home facility, I was very impressed with what the Barton was able to do for the patient. It gives patients that have never had that mobility again. It's easily used. It's good for the nursing staff. It doesn't take 2 people or 3 people to move a patient to another, to a wheelchair or into the Barton. It just takes one person.
It's a very easy and functional chair, and it's back saving. It's the only word I can describe it.
We viewed the Barton in action, and it was astounding. It really was, to see how simple the concept was, how easily implemented that it was, and how effective the transfer, with a great degree of comfort to both patient and caregiver.
As an owner, I'm concerned about my caregivers, I'm concerned about my workman's comp claims and so on. The solution to that is the Barton Positioning Transfer System.
Here's how the Barton works. It's very simple. First, you place the Barton Positioning and Transfer System bar into the brackets on the Barton chair. Stretch out and attach the straps. Pull out the handle, then crank. It's simple, it's easy, and most important, safe. A safe, comfortable transfer is not all you get, because now a stretcher becomes a chair.
The caregivers came to us and said, the thing that I love about the Barton is that now I don't have to assemble a team of people and wait for everybody to get together in order to be able to move my patient.
To move back from chair to bed, you simply place the Barton transfer bar on the bed, adjust and tighten the straps. Again, simply pull out the handle, then crank. They're safe and comfortable back in bed.
Just get the Barton transfer system, set up that stretcher, and easily turn that crank. A few cranks, and before you know it, that patient comfortably and safely has been moved from bed to stretcher, vice versa.
The Barton is a wonderful tool for not only the facilities, but for the employees and the staff, the nursing staff that's involved.
I would still recommend the Barton chair to just about any nursing facility or hospital there is.
At Butler Memorial Hospital in Pennsylvania, the Barton was tested for an entire year by 130 nurses, transferring over 500 patients. After 1 year of testing, the Barton transfer system so successfully reduced injuries, transfer time, and personnel that it is now used for the entire hospital. The ease with which the staff learned to operate the Barton was nothing short of dramatic.
The results of this trial demonstrated that we had absolutely no staff injuries, not one, by utilizing the Barton moving device. So we're just very pleased overall with the results of the trial, and we've committed to full implementation of the Barton moving device here at Butler.
Barton transfer system has alleviated a lot of the back injuries and made it extremely easier on the nurses.
We were shown how to use equipment, and pretty much a half hour later I did my first transfer.
The Barton device is able to move the patients more comfortably and with more safety from further injuries.
The Barton proved to be efficient as well as easy to operate. Both the average transfer time and the average number of people needed to transfer was cut by more than half. In fact, many transfers were accomplished by a single caregiver.
The patient is moved in a very neutral position. It's very comfortable for them, and it's very dignified.
The Barton, your safest move.